Right now, your body is quietly obeying gravity. Blood is pooled a bit in your legs, your spine is compressed just enough to keep you at your usual height, and your inner ear knows which way down is without asking. Now imagine this. In one launch, gravity basically disappears. Within minutes, your face puffs up, your legs feel strangely empty, you're trying not to throw up, and your brain is getting confused signals about which way is up. This isn't a sci-fi horror scene. This is day one for real astronauts on the International Space Station, and space is about to start rewriting their bodies from head to toe. So what actually happens to your body in space? How close do astronauts really get to long-term damage? And how do they fight back long enough to get to the Moon, Mars, and beyond? Let's start with the first few minutes after you leave Earth. The moment you reach orbit and the engines cut off, everything floats, including your body fluids. On Earth, gravity gently drags blood and water toward your feet. In microgravity, those fluids rush toward your chest, neck, and head. Astronauts call the result puffy face, chicken legs. Their faces look swollen and congested, and their legs get thinner because they're no longer storing as much blood and fluid. Your inner ear, which normally tells your brain where down is, suddenly loses its favorite reference point. The fluid in those tiny canals no longer settles, so your brain is getting mixed messages. Your eyes say you're still, your inner ear says you're tumbling. The result is space motion sickness. For the first couple of days, many astronauts feel nausea, headaches, and disorientation. It's like the worst seasickness of your life, while you're trying not to lose your lunch in a billion-dollar laboratory. But that's just the opening act. Once your brain starts adapting, a new problem appears. Without gravity, your muscles and bones think they're unemployed. On Earth, you work out just by standing, walking, and lifting groceries. Your leg muscles and back muscles are constantly fighting gravity, and your bones strengthen in response to that stress. In space, your body weight effectively drops to zero. You can push off a wall with one finger and spin through the station like a superhero. It feels amazing, until biology kicks in. Because your muscles no longer have to support your weight, they begin to atrophy. Astronauts can lose a significant portion of their lean muscle mass in just a few weeks if they don't exercise aggressively. Your bones react too. Weight-bearing bones in your hips, legs, and lower spine start losing density much faster than typical age-related bone loss on Earth. The minerals released from those bones, especially calcium, circulate in your blood and can increase the risk of kidney stones. Even your heart changes. In microgravity, it doesn't have to pump as hard to move blood around, so it can become slightly smaller and less efficient. Over longer missions, researchers see remodeling of heart muscle and increased risk of rhythm problems, which becomes a serious concern for trips to Mars. To fight this, astronauts on the space station spend roughly 2 hours every single day using special treadmills, resistance machines, and cycling devices designed for zero gravity. If they didn't, many would struggle to even stand up safely when they got back. But while the muscles and bones are changing, something more mysterious is happening in their heads, literally inside the eyes and brain. Imagine spending 6 months in space and then realizing that your vision has suddenly gone blurry. For some astronauts, words on a checklist go soft, distant objects become harder to focus on, and after landing, their eyesight isn't quite the same as before. Doctors now have a name for this: spaceflight-associated neuroocular syndrome, or SANS. Because fluids are shifting toward the head, pressure can increase around the brain and eyes. This can flatten the back of the eye, swell the optic nerve, and cause subtle folds in the retina. Not every astronaut is affected in the same way. Some just have small changes that resolve after flight. Others have more noticeable shifts in their prescription. The scary part is that we still don't fully understand why it happens, or how to predict who's most at risk. Researchers are testing everything from lower body negative pressure devices, which literally pull fluid toward the legs, to new medical scans and genetic clues. And while your eyes are adapting, the rest of your nervous system is changing too. Brain scans of astronauts before and after long missions show shifts in brain structure and connectivity, especially in areas linked to balance and movement. So you've got shrinking muscles, thinning bones, and rewiring eyes and brain. That's already a lot, but space isn't done with you yet. Deep space is soaked in radiation from the sun and from galactic cosmic rays, high-energy particles that can slice through tissues and DNA. Even in low Earth orbit, where Earth's magnetic field offers some protection, astronauts get higher doses of radiation than people on the ground. Over time, this radiation can increase the risk of cancer, cardiovascular disease, and possible cognitive problems. For a short station mission, the risk is modest. For a multi-year Mars mission, it becomes one of the top health hazards space agencies have to solve. Meanwhile, your immune system is also acting strange. Experiments show that microgravity and radiation together can disrupt immune cells, trigger inflammation, and make astronauts more vulnerable to infections. Recent research even suggests that spaceflight can accelerate the aging of certain blood-forming stem cells, causing DNA damage, reduced repairability, and stress responses that look a lot like fast-forwarded aging. So, in space, your body is juggling muscle and bone loss, eye and brain changes, immune shifts, and a steady drizzle of radiation that your cells weren't designed to handle long-term. But humans are not just biology. We're also minds living in tight metal cans, far from home. Think about being stuck in a noisy metal cylinder with the same small group of people, no fresh air, and no real way to go outside except in a spacesuit. Now add time delay in communications, strict schedules, and the constant knowledge that outside the hull is lethal vacuum. Isolation and confinement can raise stress, anxiety, and irritability. Space agencies track risks like depression, conflict within the crew, and reduced performance under chronic stress. Sleep also takes a hit. On the space station, astronauts orbit Earth about every 90 minutes, seeing 16 sunrises and sunsets a day. Without a consistent day-night cycle and with constant background noise from life support systems, many astronauts struggle with insomnia, fragmented sleep, and fatigue. At the same time, many report something beautiful, the overview effect. Looking down at a fragile blue Earth hanging in black space can trigger powerful feelings of awe, connection, and responsibility for the planet. So psychologically, space can be both stressful and profoundly inspiring, often at the same time. After months in orbit, you strap into a returning spacecraft and plunge back through the atmosphere. Now, gravity, which you haven't really felt in a long time, slams back on in less than an hour. When astronauts stand up after landing, some feel dizzy or faint. Their cardiovascular systems have to relearn how to push blood against gravity, and their sense of balance is recalibrating to a world where down suddenly matters again. Many astronauts report weak legs, wobbly balance, and difficulty walking straight. They may also be slightly taller than before, because in space the spinal discs between vertebrae expand without gravity compressing them. Over weeks back on Earth, they slowly shrink to their usual height. Rehab can look a lot like physical therapy after a serious illness. Specialists work with returning crew to rebuild strength, balance, and endurance, while doctors monitor hearts, bones, eyes, and immune markers to see what changed and what recovered. The good news is that for most astronauts so far, many of the changes are at least partly reversible, especially with proper countermeasures. But mostly reversible isn't good enough if you want to send people on years-long trips to Mars and back. So, how do we keep human bodies functioning in a place our bodies never evolved to live? Space agencies around the world run large research programs focused on human health in space. They break space hazards into categories like radiation, isolation and confinement, distance from Earth, altered gravity, and closed environments. To counter those hazards, astronauts follow strict exercise programs with advanced machines that simulate weightlifting in zero gravity. They use carefully balanced diets, vitamin D and other supplements, and sometimes medications to protect bone density and manage sleep. Engineers design spacecraft interiors, lighting systems, and schedules to support mental health and circadian rhythms. Medical teams experiment with new suits and devices to pull fluids back toward the legs, improving vision and reducing head pressure. Radiation is the hardest problem. Researchers are testing improved shielding materials, smart emission routes, and possibly even pharmaceuticals that might reduce DNA damage or improve repair. Here's the twist that brings all of this back to Earth. Studying what happens to healthy, highly trained astronauts in extreme conditions is teaching doctors about osteoporosis, heart disease, immune aging, and brain changes in ordinary people. Every time someone spends 6 months on the space station, we learn a little more about how to keep fragile human bodies alive, adaptable, and resilient, both out there in orbit and down here at home. So, what happens to your body in space? Your fluids surge upward. Your muscles and bones quietly dissolve. Your heart and brain remodel themselves. Your immune system and stem cells act older than they should, and your mind has to cope with isolation, awe, and danger all at once. On paper, that sounds like a nightmare, but it's also a giant laboratory where we're learning the rules of human survival beyond Earth. The real question isn't just, can we survive space? It's, can we arrive on another world healthy enough to explore it and then come home? Every treadmill run in microgravity, every eye scan for SANS, every blood test after a long mission is one more data point in humanity's crash course on living off-world. If we get it right, future generations might look back and see today's astronauts as the first test pilots, not just of rockets, but of the human body itself in the final frontier.